Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I talk to leading fertility, pregnancy, and postpartum dietitian Francisca Pereira-Scarfo. Francisca holds a Master's of Nutrition and Dietetics and has been an Australian accredited practicing dietitian since 2015 and a certified prenatal and pregnancy dietitian since 2018. In this enlightening episode, Francisca delves into the often overlooked world of preconception nutrition, revealing how the foods you choose today can shape not only your health, but the health of your future child. You'll discover the surprising truths about how fats, fiber, and reducing alcohol consumption play a pivotal role in enhancing your chances of conception. But this conversation goes far beyond just what to eat. You'll learn about the often disregarded yet critical role men play in this journey, the importance of blood work in identifying deficiencies, and the role epigenetics plays in shaping your child's future health. With Francisca's insights and practical tips, you'll gain the knowledge and confidence needed to nurture both your body and your growing family. Francisca, thank you so much for your time today. It is fantastic to have you here with us.
Thank you, Tammy. I'm excited.
I'm so excited about this conversation, and I know that you're going to bring some incredible insights to all things nutrition when it comes to conception, pregnancy, and the postpartum stage. And being three distinct sections, I think we should address them in their own separate ways. So if it's okay with you, we're going to start with conception because it really is just as important as pregnancy and postpartum.
Of course it is. So preconception is definitely very important. We know now that 3 to 6 months before and up to toddlerhood, that whole period can affect the lifelong health of your baby. So preconception, definitely important.
So you're saying 3 to 6 months. So that's about how far in advance of trying to
Yes,
conceive?
usually say 3 months is a minimum. And the reason for that is because it takes about 3 months for egg and sperm to mature. But 6 months would be great because you can then put into practice some of your, dietary changes that you've made, make that into a bit of a habit. So you're giving yourself 6 months to do that. And if you've got any underlying conditions like PCOS, endometriosis, thyroid issues, you've got that 6 months to address that before then falling pregnant.
And are there any specific dietary changes that can have the most significant impact on your fertility?
Yeah, so it's very hard to be specific for like a general population when it comes to fertility. So everyone will have things that target with their fertility. So again, it depends on their medical history, what they're dealing with. But as just a general guide with fertility, we want to look at 3 main things. So your fat intake, your fiber intake, and then also your alcohol intake. When it comes to your fat intake, looking at your trans and your saturated fat intake, and we want to reduce the intake of those and increase some of our good fats. So your fish, your nuts, your seafood. And then we've got the second strategy, which is your fiber. So looking at fruit, veg, and your whole grains. So all of these provide antioxidants, vitamins, minerals that are required for fertility. And then the last one being the fun police, but your alcohol intake. Studies are now showing us that for men, daily consumption of alcohol has an effect on semen volume, morphology. So basically, the semen health deteriorates with daily alcohol consumption. With women, drinking 3 to 6 drinks a week has an effect on how we ovulate. So it can affect conception then. So these 3 dietary strategies can definitely affect our egg, our sperm health, And that's the basis for conceiving, really. We want like a nice healthy egg, nice healthy sperm to be able to then conceive a healthy baby. So those 3 dietary strategies I think couples should start looking at.
That's so interesting, isn't it? And then you've also touched on a number of things that I know that I
Yeah.
want to ask you about. So that's great. It's so interesting because for weight loss, if
Yeah.
someone's coming to me and they want weight loss, I'll always say no more than 5 drinks per week. And it's always like an and or type of
Yes. Yes.
thing. And most
Hmm.
women are drinking much
Of
more than that.
course.
So that's a
Yeah.
decrease to come back down to
Yes.
5. So and you're saying that 3 to 6 drinks per week is enough to affect your ovulation and your egg quality.
Yes. Yes. I know. It's not
Isn't
fun.
that incredible? But we really don't know what alcohol
No, we
does
don't.
to
Especially as
women.
the Aussie culture, we're accepting of drinking alcohol that you almost frowned upon if you don't drink. Really educating, and it is a touchy subject because people use alcohol for all sorts of escapes. Talking to couples and digging deep into what their alcohol intake is, and then providing that advice. But I'm a evidence-based gal, so if you tell me that there were studies that showed this affects this, then really can't argue with that. Um, and most of the time, people, when they are coming to see me and they're looking at conceiving, they've probably tried already for some time. So they are highly motivated. So it doesn't take a lot to then look at their alcohol intake and think, oh, okay, I will reduce this. But then on the
Mm,
flip side,
mm.
you've got people that have been trying for 3 to 5 years, and to say to them, don't have any alcohol at all is quite hard. Like you said, we just moderate, look at what they're already having, and then try and reduce or create a realistic goal around their current intake.
I think that's a huge takeaway just in the first
Hmm.
couple of minutes. For anyone that is looking to conceive, then you should really be looking at your alcohol intake and limiting
Yes.
them to no more than 3 maybe? Would that be
Yeah.
probably because 3 is manageable, that's you can go out and you can have 2 wines one night and
Yeah,
1
that's
the
right.
other, or would you just say none at all?
I guess nowadays I don't know if you've seen that, is it alcohol fair? I have to check what that governing body is, but there's ads about not having any alcohol for the women when you're trying. So we do advise during when you're trying, so around the 2 week wait, we call it, to just avoid alcohol completely. But I guess when you're not in that trying week or couple of weeks, then just limiting to what you said. I say
Mm,
reducing it to a couple of standard drinks a
okay.
night.
You touched on so many
Mhm.
different things that we will venture into, but I think
Yep.
blood work because I feel like there are some
Yes.
processes that I'm sure that you ask your clients
Of
to
course.
go
Yep.
on, and I know one of them would be
Yep.
blood work, right? So, what type of blood work should they be considering
Mhm.
looking
Mhm.
at before trying to conceive? And, you've got your standard
Yes.
blood
Yep.
tests. Are there any additional tests that you might provide or you might
Yeah.
request that they get done that help
Yep.
provide more in-depth insights into their
Definitely.
health?
So, like you said, the standard, just your general biochemistry that the GP would normally do, looking at your folate and B12, especially B12 if you're vegetarian, vegan, looking at your iron and vitamin D, blood sugar levels, cholesterol, thyroid studies as well. So, we know our thyroid's responsible for a lot of those hormones that affect fertility. So, especially if you've got history of thyroid
Mhm.
issues, your mum, your auntie, you want to get that tested. And then celiac serology as well. Sometimes we get people that have family history, they've been trying, they're deficient in all of this, and no one's tested them for celiac disease. And so I say just
Mm.
add that on if you've got a family history, if you've got gut symptoms, and see a GP. If you're not already seeing a fertility specialist, see a GP that's specializing in the family planning preconception, because then they'll probably know what to look for.
I'm celiac, so when you talk about all of these things like iron, vitamin D, B12, I'm like, "Yes, yes, yes, I have to supplement and have, infusions and all that type of thing."
Yes.
So absolutely, and I know how important they are for my health and well-being. Like, if my levels of those
Hmm.
are down, I just don't function like a normal
Yeah.
human being
Or
or myself.
yeah, the parts of your gut that sort of inflame aren't really absorbing some of these nutrients, and they're important for us. So that makes sense that you don't feel yourself.
So outside of those more
Yep.
usual blood panels that you would be getting from your
Yep.
GP, if someone's come to you
hmm
with these, are there any other ones that you might look at and be like, "Okay, I wanna do XYZ on top of that as well?"
Generally, these would give us like a really good idea of what's already happening. Again, it
Mhm.
depends on your condition. If you've got endometriosis, we'd want to look at your inflammatory markers. If you've got PCOS, then you'd want to advocate for getting the insulin tested. And then if some of your thyroid studies come back a bit interesting, then you could potentially ask for thyroid antibodies. As a general, we just start off with that because sometimes not everyone, not when I say everyone, the doctors, not all of them want to do too many of these blood tests at the start unless it's indicated, which is fair enough. So then it's up to us to look at their diet during the first assessment, look at these blood tests, look at their diet, and piece the puzzles together and think, oh, okay, this is missing. Maybe we can investigate this. And then I'd send off a letter to the GP and be like, this is the evidence for someone trying to conceive. This is low, their diet's lacking in this. Can we please investigate it? And most of the time, the doctors are pretty reasonable if they see the evidence or that you know what you're talking about. They'll get the blood test done.
I've spoken about this quite a lot. I think it's really important as women that we have a good GP, a consistent GP that is like your person around your health. And with these types of journeys, it doesn't necessarily have to be your everyday GP that you go and see for your flus and your colds and your family GP that you might have been going to for years. It's actually worthwhile finding someone that's gonna help you.
That's on your
Yeah,
side, that
yeah.
listens when you speak and doesn't dismiss some of the queries that you've got about your health.
So in terms of that, are there any specific nutritional
Yeah.
requirements that couples should be
Yep.
focusing on when preparing for conception, and how can these specific nutrients improve your
Yeah.
fertility? Would be
So
great.
this would so you've got like your big sort of food groups, and then you've got like some of the little nutrients that you can get from supplement in your food. I'll talk about all of them, but you can just interrupt me in between. With your antioxidants and your fiber, we want to prioritize our 2 serves of fruit and 5 serves of veg. Sounds so boring, but like 95% of people in practice that I see don't meet even those. And then we also want to look at our whole grain, so about 4 to 6 serves. So the reason why I mentioned these three first is they provide antioxidants. So those antioxidants then protect our reproductive cells, which are really important for the egg health and the sperm health. They also provide us with a good gut health as well. And then you've got your whole grains that actually help with our uterine lining. So there's some studies that shows that having extra whole grains during that 2 week wait can help with the uterine lining. So fruit, veg, whole grains. Then we've got your fish and your seafood. So couples who have about 2 to 3 serves of seafood a week have shown to improve their fertility. So have more fish and nuts, your good fats, nuts, extra virgin olive oil, all of those provide also antioxidants, good fats supporting our egg, our sperm health, the uterine lining. And when you're pregnant, it then helps support the health of the baby. And then the last one I'd say is our dairy consumption. So that's really important for when you are pregnant because it helps with the bone health of the mum and the baby. So the baby generally will be okay because they'll just leach off the calcium from you. So you just need to make sure that you're getting your dairy so that you can replenish your stores. And with calcium intake, make sure you always get your vitamin D checked as well because vitamin D enhances that absorption of calcium. If you don't have enough vitamin D, then you're not really absorbing enough calcium, regardless of your dietary intake. So that's the main sort of big food groups. In terms of like little nutrients, you want to look at folic acid and iodine. So both of those are very important for the brain and the spinal cord development. And That actually happens in the first 12 weeks of pregnancy, right? So by the time women find out they've got that positive test and that they're pregnant, they're already 4 weeks into the pregnancy. So this is why that preconception part is really important. So taking the right supplements as well prior to trying, just to give you that buffer for when you do fall pregnant, you're like, yes, I was doing the right thing the first 4 weeks. Iodine is also really important for preventing a condition called cretinism. And most prenatals will have 180, so that's the requirement, 180 to 270, depending on your condition. Iron, another important one. So if you're vegan, vegetarian, then making sure you're getting your iron levels done. You wouldn't really need to have an additional iron supplement when you're trying to conceive because your iron levels really don't change until second trimester. And the other nutrient is your omega-3. So I did say that having 2 to 3 serves of seafood is has shown to improve fertility, but it's really hard to meet the omega-3 levels just with diet. So I usually say to try and supplement that omega-3 with a fish oil supplement. And then the last one is vitamin D. So we touched on calcium a bit, but again, vitamin D, you can't get it from food. You can only get it from the sun. So if you're not spending a lot of time outside, or if you're darker skin color, then you want to make sure that you've got a prenatal that has about 1,000 international units of vitamin D. But if you're deficient, then you might need more.
Already, just in those first little minute, I'm just going to
Yeah.
recap because for
Oh,
anyone
wonderful.
listening, this is just killer, right? So already your bloods, you want to be looking at your folate, your
Mhm.
B12, your iron, your vitamin D, your cholesterol, your
Yes.
thyroid. Did I forget
No,
anything?
you're good.
And then from an antioxidant and fiber
Mhm.
perspective, you want to be having 2 serves of fruit, 5 serves of veg. And I get you because trust me, I see people's
Mhm.
nutrition diaries. Let me tell you, I totally agree. Not many people are actually even hitting that
No.
as a bare minimum.
No.
Then you've got your whole grains, your 3 serves of seafood, 6 serves of whole grains, 3 serves of seafood, and your nuts for good fats, and your dairy for overall bone health.
Yes.
That's all. And then from a supplement perspective, you want to be looking at your folic acid,
Mhm.
iodine, iron, fish oil, and
Yeah,
vitamin
that's it.
D. So I take a once a week
Yeah,
vitamin D because
like a big amount.
I'm terrible at taking supplements, and I feel like lots of people, I don't know, they make me feel a bit sick if I take as
Fair enough.
well, if I'm taking it. So I just do the once a week vitamin D. So I don't know if it would be beneficial for people in that
Yeah,
preconception area. What
it
do you
depends
think?
on their levels. Got like a little cheat sheet that I go by depending on what your vitamin D levels start with. If they're super low, then unfortunately, I'm that person that will be like, you got to take 3 a day. Or, but sometimes someone will come and see me and they have 17 different supplements. And we're like, let's try and put this together. So you're taking one that's got all of these nutrients and take this separately. And we come up with a bit of a plan like that because you're right. There's no
Mm.
point giving someone a list of things to take and then they're not compliant. Then it's just a waste of money and time.
So can we dive down a little
Yeah.
deeper into
Yeah.
some of these? So we've spoken about the role of
Hmm.
antioxidants a little
Yes.
bit. Can we go into more depth on
Yes.
this?
So with antioxidants, they basically, just for everyone listening, so our body has oxidative stress. So oxidative stress is when there's an imbalance of antioxidants, which is the good stuff, versus free radicals, which is the bad stuff. And oxidative stress can be caused by underlying conditions, so whether it's type 2 diabetes, insulin resistance, obesity, or dietary deficiencies. So if we've got a diet low in fruit, veg, high in saturated fats, we're then going to increase the oxidative stress. And over time, especially now, people are having kids later. So over the years, our body probably has just a lot of oxidative stress, oxidative damage to our egg and our sperm health. So this is where antioxidants basically combat this oxidative stress. So fruit and our veggies, vitamin C, vitamin E, they all really good antioxidants. And it just helps with improve the egg and the sperm health specifically. which then helps improve overall fertility and conceiving.
Are there any specific foods? Because you've mentioned vitamin C and
Mm,
vitamin E and some fruits
yes.
and veg. Are there any specific foods that you're like, if you want to boost your
Yeah.
antioxidants, then head to XYZ?
I usually say, and this is probably like boring advice, but I usually say just a variety of colors because each color will represent
Mhm.
different types of vitamins and minerals. So too much of something is never good. We want just a variety. So looking at your diet, aiming, sometimes I'll set clients goals in a week, try and have 30 different fruit and veggies. You can count your garlic and your onion, but what else are you having? Are you having capsicum? Are you having celery, strawberries? So if you can get to the 7 days and if you've had 30 different colors and different types of fruit and veg, then you're getting all the antioxidants that's available there. So I think variety is key, and things that are in season as well. If it's not going to cost you too much, you're probably going to buy it. And
Mm.
frozen veg, so frozen fruit and veg, nothing wrong with them. So they're snap frozen. Sometimes they're cheaper than what's fresh. Broccoli at $9 a kilo. No one wants to buy that. You can buy some frozen broccoli that might be cheaper.
And you know what I love there is the seasonal fruit
Yes.
and veg, because nature is
Hmm.
incredible, right? There's a reason why these fruits and vegetables are in season at
That's
the
right.
moment, because typically they'll be holding all of the nutrients and vitamins that we actually need in a specific season. So when you look at summer fruits, and you've got all your watermelons and you've got all your very high water content fruits that are like seasonal, versus winter when you've got that high vitamin C content. So I definitely think
Hmm.
eating
Yes.
seasonally and going for what's in
Yeah.
season now is really important. But that was extremely helpful. I love all of that, especially the 30 a week. One of my clients spoke to me
Mm.
about this a while ago, and I love that I think she included nuts
Yes.
in there as
Yeah.
well. But
Oh,
it's quite interesting if you count up how many different fruits and vegetables you're
yeah.
eating, trying to hit that 30 mark is good. If you can do
Yeah.
that, you're really
Basically
kicking
just
goals.
30 different types of like your plant base. So your legumes as well, you can count them. They are type of veg, nuts. If you can get 30, you're winning.
Awesome. And so in terms of
Hmm.
folic acid and vitamin, because I know that a lot of the supplements like
Hmm.
folic acid and vitamin
Hmm.
B12 are actually crucial before
Yes.
conception. How do these support maternal and health?
So folic acid is mainly for the baby. So that's for the neural
Mhm.
tube, so the development of the brain and the spinal cord. And vitamin B12 helps actually metabolize, so use that folate up, but it's also important for
Mhm.
the red blood cell development for the baby as well. So if you're vegan and vegetarian, I would definitely get a blood test to check if you are deficient in this, because B12 is mainly from our food sources, meat food sources, and folic acid you'll have to supplement. But B12 you can easily get from your food and you don't need a whole heap. So it's also important for nerve and brain development of the baby, the B12. And I think you only need 2.6 micrograms. It's not a lot, but again, if you've got a diet
Mm.
that you're not having a lot of meat or dairy or eggs, then you wouldn't be getting a lot of B12 in.
Is there anything else that I've not added in there? What about
Yeah,
iodine?
iodine. Iodine is definitely important for the mums, supports the thyroid. So in pregnancy, and then your thyroid
Mhm.
needs goes up as soon as you're pregnant. And also for conception, because it's our thyroid is responsible for some of the hormones that are responsible for fertility. So we want nice, healthy thyroid. So iodine, a supplement that has iodine. And then you can also do like a couple of dietary changes where you swap your salt to iodized salt, increasing your seaweed intake. It's just limited as to how you can get your iodine in. So if you're supplementing with at least 180 micrograms of iodine is a good way. I think those are the two main nutrients. There's another really cool nutrient called choline. I usually love. to find a prenatal because it's actually shown to improve the baby's processing speed. And they actually did a study where they followed up kids up to age 7, and it showed continued improvement with kids that the mums actually took the choline. So it's like the IQ. At 7 years old, babies in this group showed improved processing.
That's cool. What natural sources of choline are
Yeah.
there? Like, are there
Yes,
any foods
yes,
that you
yes.
can eat that
Yeah,
have
eggs.
that
So
choline?
eggs, not see some people like getting rid of the egg yolk. Eat the whole egg because the choline is there too. Chicken, but I think if you want to get the level that we need to meet at, it would be good to add an additional supplement, especially in the third trimester. But if someone, like I said, isn't having eggs or meat, then you would consider adding it from the start, from when they're in their preconception phase. If you want a baby
So we've
genius,
spoken a baby genius. I don't think any
go for
parents would say no to a
that.
baby genius. What do you think?
No.
So we're speaking of parents, we've spoken a lot about women and, their
Yes.
role in all this. What about dads?
Yeah.
Not that many men are listening to this
No.
podcast, but I know pretty much lots of women
Yeah.
are, and they're probably gonna be like, "I'm doing all of this, you can at least eat some of
Exactly.
that."
You know what? I am so glad that you asked this question because men just get sidelined in this whole fertility talk, not because we sideline them, they just don't think that they're involved. And in practice as well, I usually see mainly just the female coming to me. Lately, I have seen a shift, seeing more guys bring their notepad and they're joining in. The father's role is so important. They provide 50% of the DNA. So the sperm literally carries 50% of the DNA, and 50% of all infertility issues are solely from the male. Shouldn't just be on the female, but just it's going to take some time for society to change its views. There's a really cool review that looked at diet and nutritional factors in male infertility. And again, it talked about the oxidative stress and how that can affect sperm health. So, oxidative stress caused from too much alcohol, processed meat, processed foods, excessive caffeine intake, and soft drink intake, and not enough fruit, veg, seafood, and nuts, showed to actually lower motility, sperm count, sperm concentration, and increase the risk of miscarriage and child development abnormalities. That's
It's
a pretty big
crazy.
one. And I feel, especially with miscarriage, when I see women post miscarriage, they always, what did I do? What did I eat? And you don't want to blame the men because it's no one's fault when something like this happens. It can be just DNA, chromosomal issues. But to know that your sperm carries the DNA and the oxidative stress can cause issues with that DNA, and there are things that you can do with your diet to help improve these numbers, then why wouldn't you be involved? The men definitely play a really huge role, and it's important for them to start looking at their diet and their lifestyle 3 to 6 months as well prior to conception.
So it's really in all aspects a shared goal. It literally takes two to make a baby, and the responsibility can't always be on the female to look after her health and well-being. It really has to be a joint effort in all contexts. And even that information around the miscarriage, because I've never heard that before, and I think that is so important for everybody to know because so many women, when they go through that, understandably, it's both partners going through a miscarriage, but so much of that guilt and blame and shame and all of those emotions sit so squarely on the female, and then the failure of their own body, all of that kind of thing. But what you're actually saying is, hang on a second, you guys are both responsible for the genetic material that goes and makes your embryo that then turns into your baby, and you guys are both responsible for the quality of that. And part of that comes down to looking after your health and well-being, especially your nutrition, and making sure that your alcohol intake is a bit lower.
That's right. It's
Mm.
crazy. It's crazy that it's not known really because Men don't really know that it does have an effect.
Absolutely, that's a massive takeaway. I love learning new stuff when I'm doing these podcasts, so I'm like, "That one's going in the arsenal."
I'll send you the paper so that you can also have a read and see what else pops up.
I would love that. So, when it comes to, because you have mentioned celiac disease, you've mentioned vegan, you've mentioned vegetarianism. So, for people that do have specific dietary restrictions or preferences, how can they make sure that they're actually meeting
Yeah, their requirements.
optimal for
Of course,
fertility?
it definitely is hard, and we can see a pattern sometimes with vegan or vegetarian where the iron is extremely low. First thing, everyone get a blood test done before when you start thinking of that you're going to have a baby, you're wanting to conceive. If you're vegan, vegetarian, always prioritizing your vegetarian sources of protein, so your legume, your lentils, tofu, and then adding extra vitamin C foods that just helps absorb some of the iron from those protein sources. And then taking a good quality prenatal as well to make sure that you're meeting all of those requirements. And if you're deficient, getting those regular blood tests done to then check what you're doing is helping with those levels. If you're celiac, it's pretty easy nowadays because we've got more options. We can get whole grain, we can get gluten-free pasta, we can get whole grain bread. But again, just getting that diagnosis and getting your blood test done so that we can make sure that you're not deficient along the way and eating the right foods. But most of the time, most people should be able to meet all of their requirements. It can be hard if you are vegan, especially that protein, that good quality protein. So it's just working with them. If someone is open to adding, because some people they are vegan when they know they've tried and they're like, okay, oh, I'll start taking some eggs, maybe that will help. I will encourage them to go down that path because it is easier to get some of these nutrients from food rather than just relying on heaps of supplements. So we'd prefer food first and then supplements to supplement.
I totally agree with that. I love that, food
Yeah.
first. And of course, I feel like if you were sitting in that camp where you did have specific
Mhm.
requirements or preferences or
Mhm.
restrictions around your nutrition, I would absolutely be recommending them going to work with someone like yourself that has all of that knowledge and is able to really help guide them through to make sure that they're meeting all of those requirements. Because there would be risks, right, of not meeting these requirements, of not addressing these deficiencies and things like that before conceiving. Like, what would the potential risks of that
I
be?
guess the first risk would be just the time that it takes for you to conceive. If you're basically just, what do they say, like the mice and you just keep going around and round and round and you're not doing anything else differently, then you're just chasing your tail. So number one is time, and that's hard if you're trying month after month, putting your life on hold. But the second one is if you do fall pregnant and you do have some of these deficiencies, it can lead to complications such as preeclampsia, gestational diabetes, early birth, a low birth weight, and I guess this is separate to nutritional deficiencies, but if you didn't prioritize your preconception nutrition and just didn't take any supplements like folic acid or iodine, then you can then affect the baby's neural tube development and other abnormalities. So bringing life into this world is a pretty big responsibility, and I feel like we just need to it's really in our hands what we can do, and just looking at your diet, getting a blood test done, it's not that hard. And if we can make those little changes and sacrifices to ensure that our future child basically has the best possible start, why wouldn't you?
Having children is one of the most ultimate sacrifices that you can
That's
do,
right. That's right.
realistically. So why not start it beforehand by giving up a few things that you love? You're just priming yourself for the whole world of pain that's about to lie. No, I shouldn't say pain. Oh gosh, maybe I'll cut that out. No, but to be fair, it's easy for us to say it's not that
Mm,
hard, But I feel like there's a reason why there are books out there called Immunity Tinge.
True.
You
So
know,
you're right.
people literally
I guess just
yeah.
being aware that you have to do something about it, like giving it thought, giving it thinking, like,
Mm,
I'm going to have a baby. I spend thousands on the nursery. Maybe I should look at spending some money on my health. And so that because my health is then going to affect my child's health. We spend money on the nursery, we spend 1 to 2 years planning a wedding. We just need to start thinking that we're bringing life into the world. If we want to give that life the best possible health, let's look at our health. And it's not just for the baby, really. Like, what are you going to lose looking after your body and not having all these nutritional deficiencies? You're just going to feel better and just be in a better space when you then bring a baby into this world.
absolutely, and I think at the end of the day, when we're looking at statistics of I think a third of couples are going down the
Yes,
route
yeah,
of
fertility, yeah,
infertility. Without getting into the weeds on this, there are definitely factors for this, and when you look at some of the key pillars of health, our nutrition is squarely in there. If we're addressing all of these things, and I think you've got to almost be ticking the boxes, right? Looking at, okay, am I doing everything that I can possibly be doing to optimize this and make sure that we're not having to go down that route? Not that there's anything wrong with that. I'm not saying that there is, but I think if you can optimize this first, you might save yourself having to go down the route
agreed.
of
That's
IVF.
right.
So I definitely think
And
that's
just
on
put you at I guess, have the best possible foundation if you were to then go down with IVF. So at least I've done everything in my power. I've, done stuff with my diet. Now it's up to the professionals to make this work. And when I say
Mm,
it's something that we should do, I don't mean that it's easy to make dietary changes. It's definitely hard, but what I meant
mm.
was just to be aware, just to know that it has an impact and to seek help to get that support. So whether you see a fertility dietitian, whether you see, I don't know, speak to your doctor about what can I do to improve these nutritional deficiencies, not just ignoring them and thinking she'll be right. Let's just try and have a baby.
That's a really good point because I feel like too many people are a little bit
Yeah.
blasé about it. They think that they're just gonna be able to start trying, and fair, some people have
Yes.
that luck, but a lot of people
No.
don't. And so you can't really be looking at this journey like you're saying, she'll be
Hmm.
right. It's not gonna be as
Easy.
easy as you think it might be.
No.
And so if you can start addressing some of
Hmm.
these areas of your health and well-being
Hmm. Hmm.
first, then you're already ahead of the curve.
Yes.
And when it comes to pregnancy, I think I've got one more
Yeah. Yeah.
question about this
Yes.
kind of preconception before we get into
Yes.
that.
Yes.
Can we talk a little bit about the concept of epigenetics and how our diet before conception, because we have touched on this when you talked about genius babies. So, can we talk about the concept of epigenetics and how our diet before conception might influence your child's genetic expression and long-term health? No, that's a
Yes, it
thing.
is a thing. So hopefully the scientists don't come for me, but it is a thing. So epigenetics is defined as changes in the genetic expression without having any changes to the actual DNA. So changes in the gene function without having any changes to the actual DNA. So it's basically how the fetus environment, so nutrition, can impact the expression of a particular gene. So the period, I think I said that before, from preconception to toddlerhood, like 2, 3 years old, we often call it the first 1,000 days. And research is showing us that this time frame is so important in shaping their lifelong health. So a healthy diet and lifestyle during this period can have actually positive and lasting effects. But if there was an exposure to environmental factors or nutritional factors before conception or during pregnancy, it can actually lead to adaptations in the fetus that might increase their risk of things like obesity, type 2 diabetes, heart disease, allergies. So it can influence disease across generations, what we do from preconception to that toddlerhood. And sometimes people are like, but the baby's out of you after pregnancy. So what can you influence but the environment? So how we're eating, and what foods we're offering. So all of that can definitely affect their disease risk across their life and across their future generation.
I'm super fascinated about the whole gut microbiome. And I think maybe we'll talk about this in the pregnancy section, because the research around that is emerging, and it's really exciting, because they thought that the gut microbiome of the baby wasn't actually impacted by the mother prior to birth, but they're finding out that it actually is. And then when you think about that, back to the preconception. So we can talk about this, like what your gut microbiome is going to influence your baby's gut microbiome. So it's all like is interconnected. So looking after your well-being and your gut's well-being will then influence your
Yes,
baby.
yeah, totally. And it's so interesting. And there's another, this is like not a gut microbiome scenario, but there's a really cool image that I don't know if you've ever seen on social media about grandma who's then, so your grandma pregnant with you as a baby, and then in you, you've actually got your eggs for your future babies. That's 3 generations that can influence the health of this egg. I think it's all connected, what we do. We're influencing health of generations to come.
Dr. Eliana Hatton off the top of my head, and she has a doctorate in clinical psychology, and we were talking about intergenerational trauma, and she was talking about how it goes back 7 generations. It is all so interconnected, and I'm people that listen to the podcast would know that I meditate quite often. So I practice Vedic meditation, and in some of the education that I've done in that, there is an image, and for every woman it just goes back and back and back and back, and it's like one of those like repeating mirrors, like the never ending mirrors, where like it just goes, because literally you are an expression of the woman that came before you, who was an express. So it's pretty incredible when you think about it. Yeah. It's such a beautiful concept, and then it goes all the way back to whoever you want it to go back to, Mother Nature maybe. So we have just gotten so many amazing nuggets and takeaway
Hmm.
points for people listening when it comes to
Hmm.
fertility. But let's talk about pregnancy now. And I understand that some of this may cross over, but I feel like they genuinely deserve their own individual little sections. So, because they are totally different. You know, what you need for preconception, you need something different for pregnancy, and then something different again for postnatal. And I think just at this point, I'm going to just remind everyone that working with someone around your health and well-being, whatever area you need, I think there's no better time to invest in your well-being than this time in your life. So, in saying that, what would be the specific nutritional requirements during pregnancy, and how do they differ from
So
pre-pregnancy needs?
trimester 1, I usually say it's pretty similar to preconception. The only thing I would probably look at is your iron. If you had a supplement that had a lot of iron, or if you were taking additional iron, but now your iron, you had an infusion before pregnancy, your iron's all within range, I would say maybe just skip the iron in the first trimester, because you potentially could be constipated. You don't want the extra iron to exacerbate that issue, but continue taking that prenatal with folic acid and iodine throughout the first 12 weeks. So that's the supplement side of things and the micronutrients. But in terms of the bigger nutrients, our macronutrients, your carbohydrates do go up a little bit in the first trimester. The protein, fat, and your total energy intake stays the same. We don't need to go eating for 2 in the first trimester. With the trimester 2, our total energy intake does go up, but this is just a guide, what I'm about to give everyone. So you really have to just base it depending on what your pre-pregnancy BMI is. So anywhere between 200 to 400 kilocalories, or 800 to 1,600 kilojoules per day is what we say to increase. and focusing on those carbohydrates, increasing those, making sure protein stays roughly the same in the first trimester. In the second trimester, you go up to about 1.1 grams per kilo per day. Again, this is depending on what exercise you're doing. If you're weight training, if you're not, then you'd want to increase your protein accordingly. And fats generally increase throughout pregnancy. But a really cool thing to note is in your second and your third trimester is when it appears to be like a window for when dietary fats and fetal adipose tissue metabolic programming happens. Perhaps maybe around this area, this time is when obesity risk is programmed, depending on how much fat the mum is consuming and what type of fat the mum is consuming. So around the second to third trimester, really prioritize the good fats and not your saturated and your trans fats. If you're not getting enough good fats from your diet, then supplementing with some omega-3s around this time. And omega-3 definitely super important for brain development, especially from the 12 weeks onwards. We usually say to stop taking high doses of omega-3 around 35 weeks just to minimize any bleeding risk. Vitamin D, important for bone development. And actually having poor vitamin D prior to falling pregnant is linked with gestational diabetes, low birth weight, and childhood risk of asthma. So correcting that and supplementing that. And then we all know iron needs just shoot right up in the second and the third trimester. So that's when you want to make sure that you're getting additional iron supplementation and getting those regular blood tests done as well to review your iron needs.
And for those, and you can
Yep.
correct me if I'm wrong here, but for those people who aren't sure why their iron needs are so high during pregnancy, especially in that third trimester, is basically the baby starts drawing down on your iron stores because for their first 6 or so months of their life, they're not actually getting iron, or they're not eating red meat, which is our major source of iron. So until they start eating solids, they need to like pre-bulk, right? So they're pre-gaming on your iron stores before they're born. So then where they can last that first 6 months without actually having any iron in their diet from food. Obviously, they get a little bit through the breast milk, but it's not enough. So that's why they really draw down on your iron stores, is to pre-game basically.
It's also important, before I forget, for just red blood cells. So for the baby to actually get the oxygen, we need heaps of those. And like you said, if the baby is taking it from us, we need to start supplying it and to make sure that we're keeping up with it.
100%. Now let's talk about protein, because one thing that I get asked quite a lot, obviously because I work in the wellbeing and fitness industry and everyone loves a protein shake. I'm squarely in your camp of food first. However, many people do struggle to get their protein, to meet their protein targets. What are your thoughts on protein shakes and protein bars during pregnancy? And do you have any kind of like supplements
Brands
that
that I
you would
prefer.
recommend around that?
Well, I haven't actually seen anyone in a while that's
Yeah.
taken them. Usually we just supplement with, like, if they need extra protein, we just go skim milk powder that's got protein and calcium. So people can add that without. The only thing I would say to look for in your protein powder and your protein bars would be any additional vitamins and minerals. So you don't want to be doubling up on vitamins because while they're good for you, there's some that have toxicity levels. So just check what's in them. If you're taking just a plain whey protein with no other additions, then go for it. Nothing wrong with it. But if you're taking one that's just got heaps of other added vitamins and minerals, then I would just stay away from those ones. And in pregnancy, we've got all these other nutrients to meet. So sometimes I feel like if you're filling up on a protein bar, you're probably missing out on getting that fruit, getting that veg in. And there's ways to sneak extra protein in from real foods without having to take too many protein bars or protein shakes. But protein powder, like a whey protein, is fine to take.
So you mention skim milk powder?
Yes, so it's got the get a couple of tablespoons and add it to your oats or add it to, I don't know, your smoothie if you're making a milky smoothie. That's a good way to get the extra protein without the fat if you use skim
I
milk.
love that. The knowledge bombs coming out of this are just like there's so many. I hope everyone at home listening to this is enjoying this as much as I
No.
am. So let's talk about weight gain because you did mention weight a
Yes,
little bit earlier, and I know this is something that many women
yes,
struggle with during
yes,
pregnancy is actually
yeah,
gaining weight and understanding that it's actually an
of
important
course.
aspect of
Hmm.
pregnancy. I know that I talk whenever someone asks me about
Hmm.
weight gain, try to talk about what actually makes up the weight gain in terms of like blood volume and breast size
Yes, that's
increase
right.
and the placenta and the
Yep,
uterus and the amniotic fluid and all that kind of
yep.
stuff. But when your clients ask you about
Hmm.
weight gain, how do you talk to
About
them about
weight.
what advice do you
I guess
give? Yeah.
it just depends on the client. So if I feel like they've got some sort of underlying eating disorder or disordered eating, then we tread very carefully around weight,
Mhm.
talking about weight in other ways, clothes, how clothes fitting, and then gauging, just looking at what they're eating. They get their scans done regularly, so making sure the baby's growing. If someone's happy to talk about weight, then I'll talk to them about weight. At the moment, we just still go by the current WHO guidelines, which just got these up here. So if you're underweight, you want to make sure that you're aiming for about close to 13 to 18 kilos throughout the whole pregnancy. If you're normal weight, it's around 12 to 16. And then if you're obese and overweight, anywhere between 5 to 11 kilos, depending on what the range is. It just has to be gradual. So trimester 1, don't worry about it. Trimester 2 and 3, when the baby's growing, especially in the third trimester where you suddenly start seeing women showing a bit more. That's where most of the weight gain happens. And if you're working closely with someone, then you can be pretty confident that the weight gain is coming from the dietary sources that you've recommended and that you're happy with. But I guess for the general population, it's hard. It's hard to know whether people are eating the right things. I'm just going to get up something because there's a study here that's really interesting. So they looked at asking women, it's cool. So they looked at asking women what they thought their pregnancy diet looked like, whether they had a healthy diet, and 61% believed that they had a healthy diet. And then when they actually looked at whether they were meeting the guidelines, so 56% were meeting fruit, 29% were meeting the dairy, and then only 10% were meeting all the other food groups. So essentially, there was like zero women that were meeting any of the guidelines, but 61% still believed they had a healthy diet during pregnancy. So when it comes to weight gain in pregnancy, like I try not to focus or to focus too much on the weight. I try to look more at like the diet quality and making sure they're hitting all those food groups and their nutrients and looking at the blood tests. I still do to check in with the weight. Sometimes you see women lose weight in the first trimester if they've had like severe morning sickness. So then you want to make sure that we're managing that well. And if there's rapid weight gain, most of the time women are pretty like proactive at telling you like, oh, Fran, this happened. I feel this way. I've got this craving. So then you just work towards healthier options. But that's the long answer to your question.
That study does not surprise
Yeah.
me one tiny little bit because I refer back to the nutrition
Mhm.
diaries that I have some of my clients fill out sometimes, and you're like, "So how's your nutrition?" "It's good," and, like, the classic one is, "Okay, great, so what did you eat yesterday?" And sometimes they'll be like, "Oh, I don't remember. I don't remember what I ate yesterday." And then when they tell you, they're like, "Oh, but that was yesterday." It's actually yesterday's probably exactly like the day before, and every day is probably the same,
That's
and
right.
you think that you've got good
Yeah, that's right.
nutrition, but the reality is when you look at it from a bit more
Of
of a
course.
step
Yes.
back, so that doesn't surprise me at all. But
Yeah.
when it comes to variety of foods, because obviously if we're talking about good nutrition and
Mm-hmm.
getting
Mm-hmm.
all of these food groups in,
Mm-hmm.
because you just mentioned the fruits,
Yes.
the
Yes.
dairy, and was it
Yeah.
vegetables that was only
So
10%?
vegetables, whole grains, and the meat. lean meats,
Only
10%.
10% of people are
Yeah.
eating there. That's okay. So let's talk about that a little
Yes.
bit. So let's talk about why is it
Hmm.
crucial to include a variety of food
Hmm.
groups in your pregnancy
Yeah,
diet? And then let's talk about what that actually does to fetal
of course. So I guess they're both linked. So it's important. These nutrients are just going to help provide the baby those nutrients. So you've got all of your vitamins and minerals, you've got your dairy for bone health, you've got protein for growth, and you've got carbohydrates for you for energy so that you're growing a human. You need that energy. And then I guess just a variety of your diet because for the baby, we're looking at taste buds that develop by 8 weeks. So by 14 weeks, I can sense taste. By 30 weeks, the taste signaling starts happening to the brain. So it has a preference. There was a study published in 2022 that looked at ultrasound and the facial expressions of babies. And it compared kale and sweet carrot. And you could see babies were either grimacing or smiling, depending on what was offered. We know that early introduction to like all these bitter flavors, either through the amniotic fluid or through the breast milk, can reduce bitter flavor refusal in childhood. The variety, what we eat, your baby then is going to eat, hopefully, as they get older and they're not going to be fussy. Also, things like allergies, exposing yourself to lots of different foods, nuts can prevent allergies for the baby. Yes, I think those food groups are there for a reason and those requirements are all there for a reason. So if we can get a variety and we can aim to meet all of those, we'll be doing ourselves and our not just our baby, our future selves a favor. So we don't have to cook 50 different meals in a family because we've got a fussy baby or fussy toddler,
Mm.
even though toddlers are fussy.
It's interesting about the food groups because I know that when the mother eats a lot of fast food when she's pregnant, and that tends to impact the baby's taste later on in life and then has like a flow-on effect to obesity, childhood obesity, all that type of thing. So if your diet is quite high in processed foods, fast foods, all that type of thing, pregnancy, then you've definitely got like it has a significant carryover to
Course,
the
or the child
child
preferred. And
later.
I think we said that, I don't know, in this one or the one before, but in that second trimester is when that fat programming happens. So the adipose tissue, depending on what the mum has, then the baby's then gonna, I guess, risk of.
Amazing. You have come with so many knowledge bombs and you have given so much of yourself. And I know that we've still got a little bit of the pregnancy to go and then we've got
Mhm.
postnatal. So I think what we're going to do, we're going to leave everybody listening on a cliffhanger to finish the rest of the
Sounds
pregnancy
good.
stuff. But I am going to ask you because I ask everyone every episode.
Yes.
What is the one thing
Mhm.
you wish all women knew before having a baby, before falling pregnant?
I feel like everyone knows this already, but get as much sleep as you can. No, but I'll give a nutrition one because that's what I do. I wish that everyone knew that our nutrition, our diet prior to conceiving does have an effect on the time it takes for us to conceive, but also on our health and on our future baby's health. It's in our hands. The health of our future child. Start now if you're planning to have a baby in the next year. Start looking at your nutrition now.
And just remember, even though 60% of us think that we're actually getting it right, very few of us actually are. So there's certainly people out there like yourself that can help with us, and don't be afraid to reach
Yes,
out. So thank you so much for your time today. You really have shared so
it's
generously,
okay.
and I really appreciate it. Thank
That's
you so
okay. You're
much.
very welcome, Tammy. Thank you so much for having me.
And if you're hearing this message, I want to say a huge thank you because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.